Okay, great. Hundreds of people have joined. More are rolling in. Let's go ahead and get started. Assalamu alaikum wa rahmatullah. As'ad Allahu masa'akum. I want to welcome everyone tonight to tonight's webinar. I'm your host, Usama Ziada, and I love working at GSK. First, foremost, and always, I wish that everyone is staying healthy and safe. This is the first webinar in 2021 coming to you from the company that gives the world its first #1 dentist recommended brand for sensitivity, Sensodyne. Thank you for your endorsement. We're coming to you live from two different parts of the world. We're coming to you from Saudi Arabia and from the UK. And I'm joined here by special guests, Dr. Ahmad Kanaan, Dr. Jonathan Creeth, and our General Manager, Dr. Andre Bakish. So right now, and before I hand over the mic to Mr. Andre, he wants to talk to you. A couple of points about housekeeping. So you must be seeing a lot of windows on your screen right now. You can minimize, you can maximize, or you can even move them around. And there will be a chat, a question chat box actually. So while we're moving along, please fill in your questions in the question chat box, and we'll take your questions right after the two presentations. So right now, without further ado, I will give the mic to Mr. Andre. Andre, the floor is yours.
Thank you very much, Osama, for this introduction. And on behalf of GSK Saudi Arabia, I would like to warm welcome all our guests on this very late evening webinar. And first of all, I would like to express massive thank you for each and everyone for your endorsement and for your support for our product. We are trying to be better. We are trying to improve our product. We offer our portfolio from Sensodyne, Parodontax, denture solution, or Aquafresh kits. So we are sort of specializing in therapeutic oral care. And today is very important day as we are offering you an improved, I would say, improved innovation from Sensodyne Pronamel. We are in consumer healthcare. We are a company with strong science-based product and innovation. And basically, we would like to improve people's life with humanity. And as always, we listen to you. We have a partnership. We are connected, and we would like to enhance our product range. So we understand that enamel erosion is a rising issue which required awareness building. That's why is this session today. So we would like to introduce you today evening product which is designed based on dentist insight for dentists. So on behalf of GlaxoSmithKline Consumer Saudi Arabia, again, massive thank you for your daily support for us and for your partnership. We feel this every day. So invite you all for this untypical remote webinar, although I feel that after this 1 year, vast majority we already think as well that this is new normal. So I believe that it will be interesting time for you. So again, thank you very much for joining. Thank you very much for all your support for us in Saudi Arabia. And this session is prepared for real experts. So now I hand over to Osama to probably a little bit more introduce our expert, yes?
Thanks a lot, Mr. Bakish.
Osama,
so Our first presenter is Dr. Ahmad. He will walk us through enamel erosion and minimal invasive dentistry. What a topic. What could be better than respecting original tooth tissues and their well-being? Dr. Ahmad is a dental implantologist. He has a master's degree in medical research from Wayne University School of Medicine in Michigan, USA. He wrote multiple articles on his field, including soft drinks effect on teeth, and he has spent the last 25 years treating the post-effect of teeth damage. Dr. Ahmad, the floor is yours.
Assalamu alaikum wa rahmatullahi wa barakatuh. I'd like to welcome everyone to this webinar. I hope you are going to enjoy this presentation, and I hope every one of you is ready and had a good, nice, productive day and fresh and awake with us. Okay. Okay, how many of you practices early intervention in dentistry? For example, a patient comes to your office and you see they have a lot of interproximal decay and they have a lot of calculus. You tell them, listen, you have incipient decay. We need to start brushing your teeth a little bit better. You need to start using interproximal cleaner like a floss. And you need to use a fluoridated toothpaste to prevent these incipient decay from getting worse. How many of you does this? How many of you practices in enamel wear damage? Do you do this in your office? Do you detect it? Do you tell the patient, listen, you have a problem, do you have an early issue? It's very important, us as professionals and as the health professionals, we look at these things and try to help our patients. We're not the clinicians just to do the work and wait till the end. We try to prevent these things from happening. This is our job as a healthcare professionals. So I get a patient in my office and they have a lot of signs of issues of their dental erosion. We have to tell them, this is our job. Today, we're going to be talking about the intervention issues. We're going to discuss we're going to identify the risk factors for these patients. We'll show you how to see the early detections. How can we tell patients that they have issues with their teeth, with enamel erosion, how to implement the preventive strategies. And also we're going to talk about health education. What can we tell these patients to prevent this from happening? Enamel wear is very important issue. And today we're going to be discussing the enamel wear due to erosion. Now, there's so many things that cause this enamel wear. One of those things is erosion, which is a chemical that affects the chemical that exposes the enamel to, like Pepsi and like acidic stuff that causes erosion to the teeth, to the enamel. Also, we have abrasion, like a toothbrush abrasion, which is a physical wearing of the enamel surfaces, whether it's from a toothbrush or heavy use of toothpaste. We have attrition, which is usually happens from grinding. So we get physical opposing teeth grinding on the lower teeth, and you end up with occlusal surface wear. We have attraction, which is the worst kind of abrasion of bruxism, which is you end up with wearing at the cement to enamel junction. So these are the causes of wearing of the natural teeth and enamel. So today we're going to be focusing on erosion because that's the only thing we can prevent as help the patient, that they can help themselves to prevent it by changing their dietary. But you can't, of course, you can't change the way they brush their teeth. You can also tell them how to brush the normal way. But today we're going to be focusing on the chemical erosion. Now, we know that enamel is very important to our teeth because enamel protects everything, protects the dentin, protects the pulp. So we know that enamel has to stay there for the rest of our life. We know enamel is composed of approximately 96% of the weight is minerals. So it's the hardest material in the whole body. It's harder than bone. And we also know that there is remineralization and demineralization of the teeth. So enamel or the enamel wear, which is the erosion, causes the enamel to weaken and you loss of some of the important substances on the teeth. Also, there is remineralization of those substances that we lost. So it's very important to know that. It's very important to know that the remineralization has to be balanced with the demineralization. If we have demineralization and the wearing down of the enamel and we don't have remineralization at the same rate, we end up having problems with the enamel. I remember a story. A patient came to me in 2016, and fortunately, he was 18 years old, and he just graduated from high school, and he wanted to join the military. So he came to my office and he said, "Doc, I'm going to start my military. I'm waiting for acceptance. I'm starting the military rotations in about 2 months. And I can't go with no teeth." So I said, "What do you mean no teeth?" So I sat in my chair. He opened his mouth and he had gone down to the gum line. He got no coronal part except I think 1/6, 2/6, and maybe 3/7. That's the only teeth he got present. You can see the coronal surface, the coronal part of the tooth, but again, it's all decayed. So this guy lost all his teeth, didn't lose his teeth. He lost all the coronal part because of the acid erosion. Bottles of Pepsi a day. So that means 1.5 liter, 2 bottles, that means 3 liters a day of Pepsi. Again, I'm an implantologist, so I see those patients, like Dr. Osama said, I see them at the later stage. Once they worn down the teeth, they come to my office for treatment. We end up extracting teeth. We end up doing implants, doing crowns, bridges, all the stuff, extensive treatments. So again, us being health professionals, we have to detect those problems at the beginning and to try to interfere and tell these patients how to prevent these problems from happening. That guy, we ended up, by the way, taking all his teeth out, and we placed 6 upper implants and 6 lower implants, and we fixed them up with screw-retained hybrid. Again, it costs, I think, close to 125,000 riyal, which is about 25,000 pounds. So again, become expensive. So if we try to prevent this from happening, as health professionals, this is our job. And then they can put ourselves out of service. But again, we know that a lot of patients will still drink Pepsi, so we'll still have some job to do. So this is the slide that shows you the remineralization and demineralization. So in demineralization, which is what the acid products does to our teeth, it loses the calcium and the phosphate on the enamel surface. So as soon as we drink something acidic or cause our teeth to erosion, we start breaking down those calcium and phosphate. And again, we have to have remineralization right away. And this is one of the things actually I learned. I'm a dentist, but I still learn every day. I learned 2 years ago when we did the launch of the other Pronamel toothpaste. I learned from reading the slides and talking to scientists that teeth, after you get the demineralization, it leaves the surface of the tooth weak and soft. So I learned last time that don't brush your teeth till after 45 minutes from the last consumptions of either acidic or any food or any drinks, because the enamel is still soft. You need remineralization before you start drinking start flossing or brushing solid. 5 minutes at least for the saliva to remineralize the surface of the enamel. So now you can brush your teeth and now become remineralized. So now you have a stronger tooth you can brush. So very important. That was the take-home message of the last lectures that we did. So again, remineralization, we gain back the calcium and the phosphate from the saliva. The saliva that we have, there's a lot of minerals there. So this helps the enamel to gain back their strength. So acid erosion, like we said, it causes the demineralization, and we lost those enamel. If frequently and repeatedly exposure to acid food and drinks, it means that the tooth enamel does not have the chance to repair itself. So we need to reduce those acidic stuff that we ingest, so to help our enamel not to get weak. Now, acidic food and drinks, like we said, it leaves the surface of the tooth weak, demineralized. So therefore, it softens the tooth and becomes susceptible to abrasion. Like we said, toothbrush abrasion happens where? Happens as soon as you finish the diet that you eat or drink that has acidic, you brush your teeth right away, you end up with loss of your enamel part of the tooth. This is when the patient becomes sensitive. They come to your office, doc, I'm having sensitivity on my teeth when I drink something cold. Well, tell him, oh, let me see. And you see there's a lot of wearing of the enamel surface, especially at the cervical part. So that's toothbrush abrasion. It could be related to acid erosion that happened first, and now you worn down the teeth. Some of the things that we ingest every day, they're acidic, but we don't know how much it is. So this is a table that will show you roughly how much acidity there is. So for example, apple juice, believe it or not, is more acidic than orange juice. And I thought always orange juice is acidic or lemon juice is acidic, usually it's more, but no. We found out here that apple juice is more acidic. And you can see all the orange juices, iced tea is very acidic, almost as apple juice. And the worst ones here is Coca-Cola and Mountain Dew. I wrote an article 2 years ago for King Faisal Specialty Hospital and Research Center. They had a soda week or the bad diet or bad carbonated drinks a week. So they asked me to write an article, and I did a lot of searching, different articles, different research in the world, and I found out that the acid, the Mountain Dew has the highest acidity out of all the soft drinks. Second one, I think it was Red Bull, and Coca-Cola and Pepsi were the third in line. So they are very, very, very acidic, and we have to be careful of those. I'm not saying that we don't drink any pop, but try to drink it in moderation. Maybe like one can, drink one of those small cans instead of drinking 330, maybe drink those small cans or maybe drink half. Or maybe after you finish drinking the Pepsi, you drink a bottle of water, small couple of glasses of water, just to kind of reduce the acidity that left in the mouth. As we know, pop has two problems. It has acidity, and it also has sugar. So sugar and acidity causes acid toothbrush erosion and causes decay. So this is the worst combination. Now, enamel wear is due to acid erosion. It's a growing problem. We know people are every day, more kids are drinking more pop, especially these days now. We're all in quarantine. We were some time in quarantine, staying at home. You get bored, you drink, you eat a lot of junk food, you drink a lot of pop just to get the day go by. So we know that people are drinking more and more of bad consuming a different type of acidic drinks, whether it's healthy drinks or non-healthy drinks. Now, who are most likely to present with acid erosion? Young adults. Okay. Now, young adults, there are 1 out of 3 adults in Europe exhibit signs of enamel wear. We're not far away, actually, in Saudi Arabia. We're almost about the same. It's not only in Europe. I can see it here in Saudi. You can see every day in our practice, more and more kids are coming with bad teeth, acid erosion because of the dietary habits that they have and acid erosion. Now, we know that healthy diet, whether you are a healthy guy and you like to drink and eat something healthy, or whether you are an unhealthy diet guy, or whether you drink alcohol or not, consume alcohol, all these, they all causes acid. So whether you're healthy or not healthy, it causes acid. The fruits, of course, have acid. The kiwi, orange juice, grapes, they all have, whether you drink it regularly or smoothie or with all mixed together, they're all acidic. Again, fuzzy drinks and soft diets also are acidic. Whether you're not healthy, still drinking acidic. And also alcohol, cocktails is also acidic. Now, the alcohol itself is not acidic, but usually alcohol get mixed when they drink it. They get mixed with soft drinks or maybe some orange juices or stuff like this. So this is the acidic part of the alcohol. Now, as we know, the alcohol causes the mouth to get dry, it goes xerostomia, and therefore you reduces the saliva, and therefore you have something sugary, and now you end up with cavities. So you got bacteria that are working on the teeth without any dilution, any saliva. So people with healthy diet, they're drinking more juices because, oh, I'm healthy. I'm going to drink a lot of juices, a lot of fresh juices. Again, this causes erosion of the teeth. Also, snacks and fruits also causes erosion. All this causes erosion. And even people that are health cautious people, they tend to brush their teeth. They tend to do oral hygiene more often. So they brushes the teeth more. And they wonder, why I'm healthy, I'm brushing my teeth a lot. Why do I have wearing? Why do I have yellow teeth? Because if you're brushing too much. So statistics show that 1 out of 4 adults in the US drink at least 1 sugar-sweetened soda, fruit drinks daily. And also people who frequently drink carbonated drinks are at high risk of developing erosion. Now, by the way, whether you're drinking Diet Pepsi or regular Pepsi, has the same acidity on the teeth. So it has the same effect on the teeth. So less sugar and less energy, but again, it still has the same acidity to the teeth. We talked about the alcohol. Again, consumption of alcohol is getting higher in the U.S. White wine is as acidic as erosion as orange juice. And some of the alcohol cocktail drinks, they have even 6 times acidity than orange juice. So they all, and sometimes, like I said, alcohol get mixed with soft diets. Again, so you still have the same acidity on these drinks. Now, early detection of enamel wear is very important. So this is our job. This is our professionals. This is our job. We have to identify the start of this acid erosion. We have to find out when they start having acid erosion, try to prevent it, try to give them advices, what to do, what not to do, to help them prevent the problem from happening. Enamels due to acid erosion is irreversible. So once you have erosion on the teeth, it's irreversible. So we help by doing composite, which eventually it will wear down, it will break down, and then patient will lose it. So therefore, it's very important to prevent acid erosion from happening by detecting it early. So the acid erosion wear diagnosis is early stage. It may be possible to protect the permanent dentition against further damage. And this is when we researched, the conclusion of the research was done in 2006 by Jaggi. So these are the signs. That's what we look for. How many of you have seen patients like this in your office? A lot, right? So we look at this patient and we see, oh, there's a little bit thinning. Why is my enamel translucent? And my wife actually came one day and asked me, she said, Ahmad, my teeth are getting, I can see through them now. Why is this? So I was like, oh my God, you have acid erosion. So again, these things, we see them and we don't kind of think too much. We think, oh, how can I do? What can I do? Can I do veneers? Can I do crowns? Now you need to think, this is a start of acid erosion. We need to think, how can we stop it? Maybe we can do something to stop it from getting worse. So early detection of acid erosion, like thinning of the early signs is of translucency. Surface changes when you see the surface of the facial surface of the anterior teeth becoming soft and smooth, or becoming smooth. So that means there's acid erosion there. There's something causing these teeth from wearing down. Now, concerning yellow teeth, now people with yellow teeth are even worse because they come to us and say, Doc, I have yellow teeth, okay? And even though I brush a lot, I brush my teeth a lot, and I did whitening, and I still have yellow teeth. So why is this? What do you think is this? What's the problem? People that are really concerned about the yellow teeth, what do? They brush more, okay? Instead of brushing once a day or twice a day, they brush maybe 3 or 4 times a day. Number 1 problem. Number 2 problem is when they finish eating, as soon as they finish eating, they go right away and brush their teeth. We talked about, toothbrush abrasion after eating less than 45 minutes. So therefore, they're doing first. Now they're brushing a lot. Number 2, they're brushing right after eating. Number 3, they use bleach. They use whitening, whether it's home whitening, office whitening. Again, whitenings have acidity in them. So therefore, they are weakening the surface of the tooth. So they are at a higher risk for acid erosion, people that they are conscious about the color of their teeth. Now, we see this patient also. Now, this becomes irreversible. Now, once you have damage to the teeth like this, it becomes irreversible. So you have loss of enamel and yellowing of the teeth, okay? You have also occlusal cupping. We see this usually in young kids. My little kid, he was 6 years old when I noticed this wearing down of the occlusal surface. He was grinding his teeth a lot at night, and I can hear him. I used to sleep with us in the same room, and I can hear him all night just grinding his teeth. And after one time, I brought him to my office for cleaning and checkup, and I saw all these teeth are like this. Again, he has softer teeth. You know, baby teeth are softer teeth, primary teeth. So he has like this look at like the middle picture, again, due to occlusal wear, due to grinding. So this becomes irreversible. Now, third picture is cervical lesion. Again, this is due to abstraction. You can see this, or toothbrush abrasion. Again, these are too late. Now we end up, the damage has happened and now becomes irreversible. Now, as clinicians, now we're talking about the clinician part of our profession. As a clinician, you end up doing crowns, you've been eating those patients and spending a lot of money to fix his mouth, 40,000 riyal just to fix his job. Where on the other hand, if we try to detect this at the beginning, we'll probably, first one, we gained the patient trust, that we told them that you have a problem. So you tell them now they have a problem with any of the teeth that come to you because they trust you, because you told them that you have a problem. To prevent this from happening, you do 1, 2, 3. So anyway, patients like this, they come to your office now. We spend a lot of money trying to fix their teeth with crowns and bridges and ship the repair teeth. Now, patient come to you like this, and this becomes a psychological issue. Now, it's not only just, oh, doc, I'm having sensitivity because of my erosion or my abrasion. Now they have really serious look. Now they smile, and if they have a gummy smile, if they have a high line lip smile, you end up with patient looking like this. Look at this. Patient come to you psychologically, they're depressed. I'll tell you a story. I had a patient, I saw him in 2008. He is a well-respectable physician. He's a cardiologist consultant, works in one of the biggest hospitals in Saudi Arabia, government hospital. He came to my office actually because his wife referred him to me. She called me, she's my patient, and she said, doc, my husband will come to you. He has a serious issue. I was like, what? He's having pain, broken teeth. He goes, no, he comes, he will tell you. He has a serious issue. So doctor came to my office, first consultation, and he was like very serious looking guy and muscular, works out very well, nice body, very healthy. Come to me, sits in the office chairs like, hi, doc, how are you? Do you have any problems? And he goes, any pain, anything bothers you? What brings you here? He said, no, I have no pain. Everything is fine, but I don't smile because I'm ashamed of my smile. I'm a physician. Very people respect me, and I can't smile. So anyway, he opened his mouth, and he has same as this picture here, exactly like this picture. When he works out, he drinks a lot of energy drinks.
So it looks like we're having a difficulty here having Dr. Ahmad. He's coming back. Hello, Dr. Ahmad. We've lost we cannot hear you. So waiting few moments. Great content, and unfortunately this is happening right now, just before or towards the end of the presentation. Let's wait for a while. I guess we need to move with Dr. Jonathan. Are you ready, Dr. Jonathan?
Hello, yes. Can you hear me?
Yes, I can hear you. So actually, now we're going to see the science behind the brand, Pronamel Intensive Enamel Repair. And Dr. John will tell us the whole story. So stay tuned. Dr. Jonathan Creeth is a medical affairs principal scientist at GSK Consumer Healthcare. He trained as a biochemist in the UK at the universities of Southampton, BSc, and Manchester, PhD. He has an extensive experience in oral care research in industry, in new product research and development, and in medical affairs. He has worked at GSK, Weybridge, where he's right now, I guess, near London since 2000. And prior to that, at Unilever Research near Liverpool. He has published over 30 manuscripts and has filed 12 patents. What a number. So please give a warm welcome to Dr. Jonathan. And the floor is yours, Doctor.
Okay, thank you very much, Osama, for that kind introduction. Yes, my name is John Creeth. I am a principal scientist in the medical affairs group at GlaxoSmithKline in the UK, as Osama said. I am a biochemist by training, and my role in the organization is to really understand how the products that we make, how they work, how they interact with the oral tissues, and how they perform their function. And it's a balance between understanding the product and the ingredients and how they work, and understanding the substrate, the tissues, normally the teeth. So a particular interest in fluoride and how to make fluoride work as well as it possibly can in oral care products, and generate the data that supports the benefits that we're claiming for our product. So it's a great pleasure for me to be here this evening. I'm very glad to be able to speak to you all. It's a rare privilege, and I would love to be there in person. I kind of miss the meeting the people I'm speaking to, but I guess we're all used to that now. The presentation, which was very nearly finished from Dr. Ahmad, was, I think, a really helpful and descriptive, revealing exposition on acid erosion and how it can affect people, and how its origins and its manifestations. So what I plan to do is just run through the last couple of slides of that presentation, because they... Are you back, Doctor?
يمكن five slides.
Okay, I think he may be able to finish his part of the presentation, which would, in an ideal world, be best, because then I can pick up from where he finishes.
Okay, sorry guys, I'm back. I had a problem with the connection, so it's back now. So I have to log out and get back in. Okay, so let's go back to the slide. So this guy, the physician I told you, I'm telling you about, we ended up doing veneers for him for the upper teeth, and we did veneers for the lower teeth. This guy works at the same hospital as my sister-in-law, and she knew him. I told her, he's going to come and see me. He goes, oh, okay, good. He's a tough guy, whatever. She comes in, she tells me after I finishes work, she saw her in a dinner one time, and she's telling me, Ahmad, what did you do to Dr. Amro? I said, why? They said, this guy, he just smiles all the time. He's very energetic. So I was thinking in my head, like I changed this guy's life. 6 months later, this guy becomes the medical director of the hospital, and he had more than 150 physicians under his management. So again, us as a health professionals, we see these things. We can change people's life. Even though we're dentists, we think, oh, I'm just a dentist. We can make a difference. We make a lot of difference. Every one of you, I'm sure that they touch somebody's heart, somebody's life, and they change their life for something better. So this guy, because of this, he ended up doing veneers, and we changed his life. So again, psychological effect is very important to help these patients with psychological effect. So again, the main problem is he's working out, he's drinking some energy drinks, so that's a problem. Number two, when you're working out, you stress on the teeth too much. Again, this causes a fraction. So now, we need to act now with minimal intervention approach type of dentistry. So what do we tell patients usually? Well, we have to do your diet, change your diet. If somebody is, you have decay, you tell them to change your diet to something less sugary. We need to brush twice daily. We tell everybody that. And we need to use a tooth, something interproximal brushing, whether it's floss or using the water jet between the teeth. And we tell them to use a fluoridated toothpaste. Now, for patients that they have early signs, we tell them to do the same thing, but we tell them to use the Pronamel Intensive Enamel Repair, which is a new toothpaste that actually came in the market a few months ago. I didn't try it yet, so I don't know how good it is, but I tried the one before that, really good. So this is the newest thing. This is one of the researched, scientifically put together toothpaste to help the remineralization of the teeth. So we're looking at the whole thing today. We talked about a few points that we discussed here. We discussed the integrity of enamels. It helps that we have to have a balance between the remineralization and demineralization. They have to be balanced. So same amount we're losing, same amount we have to gain back. We have to know that demineralization is a reversible process, thank God, but acid erosion is irreversible. So we try to prevent the erosion from happening. Enamel, where, like we said, it's irreversible. And we need to be acting in our office, productive activity. We have to search for those signs and symptoms of those patients and try to help them. We gain their trust, and if they trust us, they can give us the whole family, and we can treat. I'm finished today, and there's one more question we have to share. How does this toothpaste differ from the other fluoridated toothpaste? And we have Dr. Jonathan Creed. He will discuss this. There is questions, survey questions. Please, everyone, fill them out when you have time. I think they're found in the lower right corner. Just click on it anytime. Just answer these questions. And for this next questions, Dr. Jonathan Creed will answer it. This is Dr. Osama now. He will take it from here. Thank you very much.
Thank you very much, Dr. Ahmad, for the great content, and thank you for sharing your expertise. Back to Dr. Jonathan again.
Hello, can you hear me, Osama? Can you tell? Am I coming through okay?
Yes.
Good.
Yes,
okay.
Yes.
Thank you, and thank you very much, Dr. Ahmad, for managing to complete that. It was, as I said, a very helpful and clear, I hope, description of the issues of acid erosion and the tooth wear that really sets up the need for appropriate treatments that can help individuals, your patients, manage their risk of erosion. Some of these lessons I've been understanding uptake is a statistically significantly greater degree of fluoride uptake from intensive enamel repair versus the competitor product.